Good morning. I'm Beatriz Gros. I work as a consultant gastroenterologist in Spain, Reina Sofia University Hospital, and I used to work here in Edinburgh as a clinical fellow with Professor Charlie Lees. What we are going to talk about is the dietary data from PREdiCCt study. As you're aware, the rise of inflammatory bowel disease diagnosis has spiked in the last decades. And we have an idea on whether there are different risk factors that are driving this increase in the incidence, especially in the Western world and more recently in lower income countries. This is getting a bigger problem. And we know there are some dietary components that may be associated with the increased risk and also other environmental factors. What we do not know is once the disease is diagnosed, whether different dietary components and or any other environmental factors are associated with an increased risk of flare. And that's what we wanted to answer, especially because most of our patients come to clinic asking, what should I eat? And we wanted to answer this question. Well, we analyzed over 1,000 patients' dietary data over a long period of time until they flared. And we compared the people who were exposed to different components, especially meat consumption, dietary fiber, polyunsaturated fatty acids, and ultra-processed food consumption. And what we could see is that patients with ulcerative colitis who were eating more meat, we could find an association between the risk of flare and meat consumption. Meat considered as both red meat and white meat. And this is one of the biggest findings that we found. We could not find any other association between the other components and the risk of flare for either Crohn's disease and ulcerative colitis. And we hope we can share this data later through the day, and also it will be published soon. Thank you very much.